I want to welcome everybody tonight to another program in NENIC's COVID series. And tonight is Running with COVID Vaccinations at Lifespan Health Systems and Best Practices. And we are thrilled to welcome Lori Connors, the Clinical Informaticist, and Louisa Jones, Application Manager in Regulatory and Quality Improvement for this exciting presentation. I've known both of them for a long time and are thrilled that they're with us tonight to offer their expertise and welcome them to the NENIC community. Lori's been involved a long time. Louisa, you've been to a meeting or two in the past too, so it's nice to have you back. So we really are thrilled. So tonight's evening is going to be a front row seat, and we're going to talk over a number of different things. We're going to look at how the organization prepared for vaccine deployment as with the Rhode Island Department of Health. We're going to talk about the build and some of the logistics with scheduling and registration, some of the fun components like widgets and wizards, scheduling of second dose, order management, and interfacing with RICAIR, which is the Rhode Island Child and Adult Immunization Registry, as well as training, organizational communication, and reporting. So with that being said, I'll turn it over to Lori, and I'd ask everybody to put themselves on mute, and we look forward to this evening's presentation.
Thank you, Mary. I'm glad to be here tonight. So Lifespan, for those of you that don't know, is an academic health center located in Providence. We're affiliated with the Warren Alpert School of Medicine at Brown University. We have 4 hospitals, one of which is a hospital within a hospital, a children's hospital. We have over 1,100 beds. We've had over 260,000 ED visits. We have 190 clinics. Outpatient visits are over 900,000. We have 40,000 plus surgeries a year, 62,000 plus patient discharges, around 16,000 employees, and 2,000 physicians that we work with. All right, so there's the first glitch. It doesn't want to go forward. There we go. So we have nothing to disclose at this point. So as Mary said, she asked what title should we give this? And I'm like, Mary, I'm running like from one place to the next. So we decided we'd just go with Running with COVID Vaccinations at Lifespan. So we'll talk a little bit about what when we first got involved. So, well, Louisa and I were both asked to be on a vaccine task force. And the first notion that we had of this task force was back in November 12th. So apparently, the Department of Health had been working with folks at CDC, kind of deciding, where the next vaccine becomes available, when and how are we going to make it available to folks out there, get it in the arm. So they did form a task force, and they involved our pharmacy group at the Lifespan, and pharmacy had been working on it, I think a month or maybe a couple before us. And really what they were working on, they had some subcommittees already, one of which was the prioritization and legal subcommittee. So these folks were really working with the Rhode Island Department of Health with their guidelines, who can we vaccinate and when can we vaccinate? And the DOH was telling them that they were able to do their frontline workers and their employees. So again, legal, they worked with how do we prioritize this? And then they started working with another group, a logistics and vaccinator group. These folks were responsible for actually, trying to decide where are we going to have these sites at all of the hospitals? How are we going to get the employees there? What kind of equipment do we need and all of that? And then that's when we kind of got involved, just as the logistics folks were going out and trying to find space. In the meantime, the communications group at the hospital, communications and marketing, were working to get the word out that yes, Lifespan's going to do something, and we are going to vaccinate our employees like the Department of Health and the CDC said we should, and here's how we're going to do it. So Memos went out to from the hospital presidents to staff. It also had to be sent out to our physicians group because they're not necessarily employed by the hospital, but work at the hospital. And then we also, as time went on, had an internet hero. So basically those first couple of vaccines that we gave out, which was probably a little over a month after we got involved, we had those folks on a campaign just stressing the safety and the efficacy of the vaccine so that we could get more and more of our employees vaccinated so they would then be able to care for our patients. So throughout the process, like I said, we got involved in November. We really stressed the importance as clinical informatics and IS and IT that we really needed these sites identified sooner rather than later. We weren't going to be able to build or know what type of equipment they needed until we knew where they were going to hold these vaccines. So we did have our informatics nurses at each of the hospitals. We tried to get them involved as well to go out and do some of these walkthroughs, just to kind of decide what were the networking needs, the IT needs, laptops, do we need phones, where's the Wi-Fi in these areas, so that we would be able to get operations up and running as soon as possible. We did decide on using an activity that we had used in the past for one of our lifespan community health centers, and that was called an immunization clinic activity. With this came scheduling issues. How do we get the tiers of employees to come to these immunization clinics when they're supposed to? So again, with legal going out there, there really was a stickler that you could only go for your vaccination when you were told to. And there were tiers, you know, frontline workers and then down the line as to what workers could get vaccinated next. And that really was driven by the Department of Health as well. There were communications between the pharmacy and DOH constantly on a statewide DOH task force, as well as our own internal lifespan task force. So the first thought that we had was to do open scheduling. And I know you're probably all cringing, and we kind of did too. When you have a URL out there and it's just open scheduling, you worry about that URL being given out. So we did, as IS, say, we're a little worried about this. How operationally are you going to control this URL? You know, they really did a nice job between marketing and the managers at each of the sites and the task force to say, look, each manager is going to get this URL. And when you get that URL and you have identified your employees that are going to be able to get vaccinated, you can give them the URL. It was strictly enforced with the employees that this URL was not to be let out, and that you know, there would be some repercussions, so to say, if it potentially was. I would say that for the most part, we had a really good adherence. We might have had one or two folks slip through that gave out the URL and had a couple of family members come in. That was quickly shut down, and realistically, they did do a good job with their employees of getting folks to come when they were supposed to and not give out the URL. So the next thought was, you know, as we move on and it's no longer just our employees, but maybe we start doing our internal patients, whether it's, and again, adhering to that CDC guidelines, and the Department of Health for Rhode Island was 75 plus, and we're still at that 75 plus age range. So how do we get some of these folks in? So the first thought was, let's move on to a ticket scheduling. So folks that have, so if you haven't, don't know Lifespan, we do use Epic. I know some of you use that as well. So we have what's called MyChart. Folks, it's a way for them to look at information in their chart to see when they have appointments, medications, that sort of thing. So the next thought was, well, maybe we can try some ticket scheduling. We can invite folks to go on to MyChart and actually schedule their vaccinations. Also with our outreach sites, so our community health site, maybe we do some phone scheduling for those patients. Again, our concern was 75 and plus, they're not all computer savvy. So even if we move it out to our patients 75 and plus, they might not have a computer. They might not have a way to get onto the intranet, even if they may not have a MyChart. So we decided, you know, there were alternate ways that we were going to have to schedule moving this from our employees over to our patients. So there was some phone scheduling done. As we have moved on, and we'll talk about this a little bit later in the presentation, we have also moved to some web attestation pages, which then would have a buried URL in there for open scheduling, and that would be for public and our retail pharmacy. So we do have 2 retail pharmacy sites at Lifespan. So this would be a way to get patients and the public to be able to say, yes, I am over 75. Okay, next step. Do you have any of these conditions? Do you have, you know, have you had vaccines in the last 14 days? All of the questions that we needed to ask in order to get the patients vaccinated. And remember, we also need to get our patients in for a second dose scheduling. So all of those scheduling issues came up, and they were all things that we needed to kind of really work through almost from day one, I would say. We've kind of fine-tuned them as we've gone along with each site that we've opened, but we really needed to think about how we were going to do each one of these different groups, starting with our employees, moving on to patients and public. So we did have support. Our vendor, like I said, did already have an application, and we had already used that immunization clinic activity for a flu clinic for our community health clinic. So we did have a process. I would say it took a little convincing on our part to allow, not allow, but to let the vendor know we were going to go with this immunization clinic activity, that we thought it was the best because we really needed to get these employees in and out, shot in the arm, bye, see ya, as quick as we could. So we did stick to our guns about using the immunization clinic activity. And as we've moved on to try and get patients and public involved, our vendor has been right there by our side. They have been helping us get what we need to move on, and really has gotten us answers to our questions pretty quickly for us to be able to provide a service for the public as we're moving forward. And by the way, they have also endorsed using the immunization clinic activity build in their most recent webinars. So we felt pretty good about that. So just a high level build workflow, obviously we need to, our patient, whether it's an employee, public, or a patient of your healthcare system, they need that vaccine, right? So we need a way to get them scheduled. If our employees had a MyChart account, then they can move on and schedule through MyChart. If they don't, we gave them a way to be able to be a guest so that they could schedule their vaccine. Once they were able, so we're frozen. So once they were able to schedule that vaccine, they then would show up on a multi-provider schedule, and we then would know, patient would then show up for their visit. We could ask all of the registration questions. So talking about the logistics earlier, what did the sites look like? So we needed sites that would be able to get people in one way and out the other way, right? Because we didn't want people to have to cross over and expose themselves any more than they already were. So most of these sites had one way in, one way out. They had a desk that you stopped at. You got a paper consent. That was the decision of the group to do a paper consent. And then you were handed, a couple of papers at that point. So the paper consent, and then you were given a fact sheet. So these were, it's kind of the emergency use authorization facts. So you would know what to expect when you got your vaccine. Different vaccines, different EUAs, they were handed out. You also received a VSafe paper. So VSafe, if you haven't heard about it, is just a way for the patient to then scan and have an app on their phone so they could get prompted every day from basically the CDC to say, what are your symptoms? Do you have any symptoms? How are you feeling today? So those were the papers that were handed to each patient. And by the way, we were told we had to hand those to each patient by the Department of Health. So those were handed to each patient. They then went on to another line where they would wait to actually go in and get their vaccination. Once they got their vaccination, very similar to what it says here, we would then make a second appointment for them. So schedules were built for these different clinics on each site at the hospitals. And then a second dose schedule was also built. So based upon 21 days, and we gave them a plus or minus of 2 days on either end. So based upon that, the scheduler had a one click, and literally that was the name of it, as well as it really was just one click. So they would click that button and they would be brought a schedule for the 21 days for Pfizer or 28 days for Moderna, plus or minus 2, to be able to give that patient a second day appointment. After they were made their appointment, they went to a holding area, kind of another room, for 15 to 20 minutes, where they could be 15 to 30 minutes, so that they could be monitored appropriately as per the guidelines. At that point, for our employees, we were not charging because we don't usually charge for employee vaccinations. However, we have since then, since we're moving into the public realm, we have been told, obviously we can't charge for the vaccine because we're getting it free, but you can charge for the administration of the vaccine. So we have gotten billing involved, and we have set up billing for each of the different sites that we have going forward. And the reminder that once we are done with these vaccinations, when the appointment is checked out, in our case, at the end of the day, we have a report via HL7 interface that goes to RICAIR. And oh, I guess I didn't go right to RICAIR. Louisa, you're on in a couple more minutes. I guess I put the build up here first. So
as it should be.
Building the immunization clinic activity, like I said, it was part of our vendor applications, so we took that fully. What we needed to do, we thought, was build departments, but as it turned out, our employee and occupational health services departments were already built. So we were able to utilize them and set up a separate schedule for them in each one of their sites, so at the 3 major hospitals, to be able to allow our employees to schedule through there. So that worked out really well. The next thing we had to think about was, when folks are coming to a mass site of immunization, you need people to be the immunizers, right? So there was a call that went out from our HR department saying, hey, we'd love to get volunteers to help us out with this. We did have some contract labor that helped out, but we had many, many people that wanted to help. So we had pharmacists, we had pharmacy techs, we had pharmacy students, we had NPs, we had PAs, we had nurses, clinic nurses, inpatient nurses. So with all of these different folks that wanted to come and help us, thank goodness, we had to make decisions on their access, and we call them templates. Were we going to give them security points so they would always have these security points, or were we going to give them template overrides? And at the beginning here, we had decided that we were going to do template overrides for these folks. So they would have the tool, being that immunization clinic activity, that they would be able to get into and do the work that they needed to vaccinate our patients. So just to kind of look at the bill so you can see what these folks are doing. Basically, there is a, once the patient, whether it's our employee, whether it's our patient, whether it's the public, once they set up a appointment for themselves, they will show up on that department's multi-provider schedule. So this is our multi-provider schedule for our employee health clinic at Rhode Island Hospital. Excuse me, once the patient is there, basically all you need to do is highlight the patient. You come down here. This is actually, you know, a drop down. So depending on what vaccine you're given, if you have Moderna or Pfizer or one of the ones coming in the future, you're able to click that. Now we have something called lot manager. So our pharmacy is taking over when they get these vials of vaccine, they're putting it in this lot manager system, which very nicely gives us a number and fills in some of our other information. So again, a very quick process so that we can get these shots in the arms and get these folks out and the next one in. And then all of the questions that you're probably very familiar with, is it part of a state supplied vaccine? Do you consent to it? Were you given the VSafe form? All those questions were built into the side here. We did default left deltoid for, again, ease of our immunizers, so they would have one less click. We felt the majority of people were right-handed. I have gotten a few folks asking me, how come you chose left? And I said, well, majority of folks are right, but I'm taking it that you're left-handed. I said, you can certainly change it to the right deltoid. But quite honestly, some people don't even bother. But yeah, that's why we defaulted it, just to try and give folks one less click if at all possible. In the middle of our, I'd say maybe 3 or 4 weeks after we started vaccinating, we did get an upgrade from our builder, which allowed us to see this sidebar. So if you had already gotten an immunization, it would be here. The type would be here. So again, just a kind of a visual for that immunizer. Oh yeah, you got Pfizer before and I have Pfizer to give you today. Great, we're all in sync. When I talked to you about one click for making that second dose appointment, you can see right up here, there's a button that says one click. So literally you would hit that button and you would get the schedule that was available for this patient to then schedule their second dose appointment. And that was it. I mean, this was most of this filled in. You did have to answer all the questions. You hit administer, you'd come up here and do your one click, and then you'd send your patient to the next room so they could be monitored. And now Louisa is going to take it away with the integration to RICAIR, which is our Rhode Island Child and Adult Immunization Registry.
And for those of you that are familiar with Rhode Island, you know that our immunization registry used to be called KidsNet, and we used to only have to report vaccines that were given to people under the age of 19. Earlier this year, however, Rhode Island Department of Health switched over to accepting vaccine records for people of any age. And fortunately, they did, because that meant they were ready for us to start sending them the COVID vaccine, which is a very fortunate thing. So at the end of the day, what happens is we batch up all of the vaccines that were given at any location throughout lifespan, and we send those transactions in a standardized format to the Rhode Island Department of Health. There are 20 data points that are required by the CDC. They happen to be the same 20 data points that are required by the Department of Health. So that all works very well. It's important that we report within 24 hours of getting the vaccine, because this information does go direct to the CDC, and they are they're very intent on tracking who's getting what vaccine when, and they're very serious about that. So that is why it's important to be reporting these vaccinations timely. What else have we got, Lori?
I think we're going to go on to training and then maybe reporting. How about that?
Okay, you want me to do
All
training?
right. If you'd like, it's up to you.
Yeah. So we wanted to facilitate training so that people could A, do it remotely, B, do it fairly easily so that they didn't have to go to a classroom. And although we are, Lifespan does have some situations where we're doing in-person training, this was not one of those things. These people were assumed to be Epic users for at least one other application, that they were assumed to be some sort of clinical user. So we felt they could have online training. And the immunization activity really is a stripped down, streamlined, efficient workflow. People have had no problem adopting the workflow. It's all right there in front of them. I can attest, having been to an immunization clinic twice now, that those places run like a very well organized operation. And having the, training the immunizers to do that second schedule with the one click that Lori spoke about made it very easy for everybody. And since you've got to give them the card, you might as well write the second appointment on it. So that all worked very well. We've used standardized visit types throughout the organization, makes reporting so much easier. And a special thank you for Lori for insisting on a downtime form when we started, especially when we started taking it out off of, campus and outside of employee health. Turns out that when we were expanding in one of our brand new locations as of yesterday, we weren't quite ready for them to document in the system because we'd just done an upgrade and we hadn't been able to move the new building to the system yet. So they use the downtime form. So lesson for everybody, when you're rolling these things out, make sure you've got a downtime process. That turned out to be very important. We would not have been able to go live with that clinic yesterday had we not had the downtime form. Very important.
Yeah, and the one of our nurses, one of our other clinical informaticists just happened to be one of the vaccinators there. And these folks were 90 and 100 years old. And it just like warmed her heart to be able to give a 100-year-old the vaccine, even though she had to write it on a piece of paper. It just made her feel, and all of us feel, really good that we did have that piece in, and that poor 100-year-old didn't have to wait another day.
Yeah.
So. Okay, reporting in, everybody wants to know, what are you doing? How are you doing it? I'll leave this up here. I'll let you know that we have done over 15,000 patients that have had the second vaccine is over 9,000, giving us a 62.3% of people having a completed dose. Now, we did move out from our employees. We were asked, and I'm not tooting our own horn because it's a gift and a curse, right? So the Department of Health has asked us to move out. We started vaccinating other healthcare givers in other practices so that they could, again, take care of their patients. So some of those numbers are in there. We also have moved out to doing some of our cancer patients at our cancer centers. So in all, we've done over another 1,000 folks that don't show up on this Power BI because this is used for our employees. And I don't know, do you want me to continue, Louisa, or would you like to do I know you.
Yeah, let me finish this out. I'm looking at the latest numbers and we're actually up to 72%, over 72% of our employed workforce. And of those 72% immunized, 76, almost 77% have had their second vaccination. Now we had to put a pause on doing more of our own employees while we caught up some of the other healthcare workers in the state, but we will resume vaccinating our employees as soon as we can. So Power BI is a very flexible tool. It allows us to do dashboards that are graphical just like Lori was showing you, that was a Power BI report. And lets us do the drill down so that those dashboards are actually interactive. And you can click on the legend for one of those bar graphs, and it will highlight more detailed information for you for that bar graph. So it's just a very, very handy tool. There are other visualization tools out there. And so it definitely makes it a user-friendly way. Executives love it. Department heads love it. It really lets them look at the data in their own way so that it can be useful to them in their role. So definitely want to make sure you're doing that kind of reporting. But that's not the only kind of reporting that you're going to want to do. You're going to want some operations reports as well as these executive managerial dashboard reports. You're going to want reports of, okay, who's had one vaccine but doesn't have a second vaccine appointment? Because things happen and appointments get canceled and then they don't get remade. And so you're going to want reports where you can track and find out who's missing a vaccine. You're also going to want reports that you can run of who in your patients, among your patients, is eligible for the vaccine. So for us, initially, that was patients 75 and over. And so we were running all these reports, who's 75 and over, who can we contact via the portal, who do we need to have the clinic do outreach for? And we did those various forms of communication. Now we're in a place where we're not just filtering on, are they the right age, but have they already had a vaccine? Because if they've already had a vaccine, there's no point in doing that additional outreach unless they're coming up on time for their second vaccine and they don't have an appointment. So you definitely want to be thinking about those operational reports. It's not all about the managerial executive reports. It's really about doing that follow-up care that organizations are really good at doing, and not letting people fall through the cracks.
Yeah. And although this appears on our reporting BI screen here, these are really key to the entire process of this project. So our build team and our training team were with us from day one. And literally when I say day one, it's day one, night one, day two, night two. They literally were working around the clock. Very happy to help. Everybody on the project has been very happy. We want to get these vaccines into people, and there really has not been anyone who says, oh, it's not in my normal hours. Unfortunately, we've had to tell people to take some time off because they would just keep on working with us. And we really appreciate that. The communication that's going on between operations and our build teams and our training teams has been fantastic. And I don't think we could have done it without such an A team. Clear documentation, making sure that we have what we need documented so we can always go back and, like Louisa said, look at reports, and our communication and marketing teams along with our HR team. Again, a huge process that we have been able to maintain since November. Lessons learned, at the beginning, our immunizers wanted to help so badly that they just signed up and they would go to any clinic, and then they'd show up at the clinic, but they didn't have the tools they needed because they didn't realize that what we sent out to them was not only sign up, but you need to view some net learning. This was our way of showing them this new clinic build. And by the way, we have to grant you the proper access. So we did have to kind of like pull them back and say, we really, really want you, just make sure you do these steps first. Tip sheets, a lot of times training wise, you don't want to do one tip sheet for one person. But because this was such a new build and a new process, we did need to come up with a few things. So cancel and reschedule appointments. We needed to introduce that and have people working on that. We ended up getting a telephone center kind of set up to help with that. What happens when they have a reaction? So we learned early on that, oh, there's some people that are going to have reactions. And by the way, there's some people that might be considered high risk. So we did set up some high risk clinics for those folks that have had anaphylactic reactions to either shellfish or another vaccine. We have a sign up list for them, and we personally call them, not me, but we do personally call them and get them into these high risk clinics. And we will continue that. Our discussion tomorrow, maybe, or next week, is to get these high risk clinics open for the public, because we've been asked to do that from the Department of Health as well. One other issue, you know, with employees signing up themselves, some of them don't remember that they had this so-called My Chart, and they would sign up without using the My Chart button, and then we would have Stephen in My Chart, but when he signed up for his vaccine, his name is Steve. So then we got these shell records that were created out there, and you know, it set up a little bit of extra work for our HIM team. So they had to go in and they had to kind of say, all right, is Steve really Stephen? And can we put those two together as one chart? We did, they worked it out, and we really haven't had as much of a problem with that going forward. But again, things to think about. But like I said, the URL leaked out, not that, it could have been worse, and it wasn't, so we were happy for that. And as we move forward, we're hoping the same thing happens. Next steps, which I did this almost a week ago, so I can really give you, Louisa's laughing at me. I can really give you, so ambulatory clinics. We want to set up these clinics at a couple of sites so that our patients can go. So we have what we're calling hospital within walls, right? So it may not be right at one of our hospitals, but it's at one of their locations off site. We have been approved that these are okay to have these vaccination clinics at, and we will be setting up tomorrow, actually, well, yesterday we had the one at Newport. Those folks were done on downtime. We got the build in place today. So they will actually be starting patients again tomorrow. We have a second one going live tomorrow. We have discussions, again, another meeting tomorrow for our inpatients. So are we going to do our inpatients first doses? If we do, we need to be able to give them a second dose appointment. The logistics to that are a little difficult right now. Pharmacy is not quite sure they're going to have the product, but they also don't want to lose product if we have one of these ambulatory clinics at the end of the day that has, you know, a few doses left over. We want to make sure we get them in somebody's arms. So we're working on the logistics of potentially bringing those doses at the end of a clinic back to one of the hospitals for our inpatients. We have already done a couple of second dose immunizations for inpatients. We were alerted that, you know, folks were coming in for surgery from a nursing home or an assisted living, and we were able to go up to those units and give those folks their second doses so that they did not miss their second dose. Urgent care centers, we're not quite ready. We do have 3 urgent care centers at Lifespan. They are waiting on their doses from the DOH. And as soon as they get those, they will be, they already do immunizations. So they're going to follow their same workflow. They've already gotten their refrigerators. So they're all set once they get some vaccine. Our community outreach folks are going to begin their vaccinations on Monday. So they're going to some public health centers to be able to do those. They were different. So we talked about scheduling earlier. They are doing all of theirs as phone scheduling. So they have host centers that they'll go to. So these older folks that don't have that technology, the host center can help on the phone, get them the appointments for their vaccinations. And then they make an appointment 3 or 4 weeks later based on the vaccine that they're giving. And those patients all have to come back in that 3 or 4 week period. They don't necessarily get that 2 to 3 day flexibility like others do. Our retail pharmacies, we have 2 retail pharmacies. They are opening a site again off campus. and they will be starting on Monday. So they're scheduled for at least 3 days next week. They are going to run with kind of like a web page cover. So in order to schedule, you're going to do an attestation. Yes, I'm 75 or plus. Yes, I live in Rhode Island. And then you're going to be brought to the larger list of questions. Have you had a vaccine? Have you had any anaphylaxis, etc. Once they get through all that, they'll get their URL that allows them to schedule at this retail pharmacy site. As Louisa was talking about the reporting, we are working on and should have probably a view of our ambulatory department needs tomorrow. We have a reporting meeting so that these ambulatory departments can now report out separately the same way that you saw our employee health Power BI. So it is a Power BI report. We're very happy we got everybody to go on that page. So the graphics, I think, really help people no matter whether you were higher up or not. So yeah. So those of you that know me know I couldn't put this together without some Post-its. They are part of my life. What questions do you have for us? Mary, I think you're on mute.
First of all, I just want to say thank you so much for such a wonderful presentation. You offered us a lot of information in a very short period of time. And of course, we already have some questions. I asked people to jot them down in the chat box, but I'm sure people are going to ask other ones. But the first question is, have any employees refused to be vaccinated? And did you have a policy and procedure or anything in place to manage that scenario?
Good point. I was going to say that and I never did. It was in my practice though. Yeah, so right now we are not mandating employees to be vaccinated. There are folks that have not been vaccinated. I just know from people saying they're not going to, but that was kind of our whole hero thing. So, as the word gets out and now with the Power BI, the different departments can kind of drill down and say, oh, geez, only 4 people on my, 40 employees got vaccinated. I wonder what the problem is. Let me go out and just give some more information. So that's what they're kind of doing now, looking and drilling down and saying, oh, is there something, do we need to give them a little more information?
A quick question I had is that I've known people have signed up. You mentioned billing, and I was wondering if that was a little controversial because I know people can go through the state and, they can bypass, what insurance do you have, et cetera. Can you talk a little bit about that? Was that a big deal or just not a big deal at all?
So I haven't heard of anybody that has questioned it at this point. The state does allow us to do the administration, so it's not a huge charge. And we have had it mostly because they're 75 and plus, it's the Medicare Advantage at this point. So the client will never get a bill, just so you know that. If the insurance for some reason denies it, we are not allowed to bill the client at all. So the patient will never really see that. If the public declines, I'm not really sure. And Louisa, I don't know if you saw the demo. With the open facing one for pharmacy, is it mandatory to put in their cards?
No, it's not mandatory. If someone has no insurance, they still get vaccinated.
Yep. So we will not turn anybody away. Yep.
Right. Unless they don't meet criteria.
Right. Then we will.
Excellent.
And we have.
I have another question. Were there any issues? Do you have a single ordering provider for the orders? And how is that? Maybe you could talk a little bit about that.
We have supervising providers with the immunization clinic activity. And so a specific site will have a supervising provider for that site. And we have protocol orders for sending out the ticket scheduling.
I don't have any more questions in my chat. Is there any other questions from the?
This is Andy. I have a quick question. You talked about the reporting to the Immunization Registry. How bidirectional is that at this point? I can imagine going forward, you're gonna want to know that information on your patients coming in
Yep.
more so than
And
you do now. But what is that communication like right now?
so right now, yes, the Immunization Registry is a bidirectional interface, meaning that we don't just push information to them, we can also pull information. And we've had a bidirectional interface since it was mandated by Meaningful Use years ago. And so what happens with us is we have a trigger that when you make an appointment and when you arrive for your appointment, 2 different times, we will do a query. We'll send a query out to the state registry for any information that they have on you regarding your immunizations, and then they send that information back to us. You can also manually trigger the query if you want to. And that way we have the most up-to-date information as early as we can get it.
Thanks. Anybody
Thank
else?
you. Yeah. Can I just have one follow-up real quick?
Sure, of course.
Sure.
So if you're administering both doses, are there situations, I mean, this is me being naive at this point, but are there situations where you're administering a second dose where you haven't administered the first and you'd be leveraging that data then, or
Well,
that
yes,
doesn't happen yet?
there are situations where someone else administered the first dose and we're administering the second. And we have had that happen. We've had a couple of inpatients already where they received their first dose elsewhere and they were due for their second dose while they were an inpatient with us.
Anyone
And
else?
thanks for that lead up question, Andy, because one of my questions was, how is that communicated to you that your inpatient is due for their second dose?
Well, early on, I think it was communicated to us by the patient's home. I think they were a long-term resident at a nursing home or an assisted living. And so that came over as part of their paperwork. But if ever we had someone else come in, that's part of what we're working on with our inpatient strategy is what alerts do we want to build out so that when someone has had a first dose elsewhere, vaccinated elsewhere, that we would have a pop-up or some sort of alert that would notify nursing that the patient's due.
Yeah, and just to expound upon that, so I'm sure many of you with the COVID have had contract labor come in to help you out. So because of the numbers of patients that you had, and some of those folks were vaccinated elsewhere. So before we could give them the second dose, we did need to see their card that they are given, that every patient is given when they get vaccinated. We needed proof that they got the first one and what vaccine it was. So if we can't pull it from a registry, we would need to get some kind of proof at this point to be able to give the second dose.
Yeah. And today, most of your organizations are hooked up with health information exchanges. And so your state registries are required to have a bidirectional interface for immunizations, but also you are probably data sharing with your high volume patient sharing partners. And so you're probably getting a lot of that information directly from them.
Yeah, so a full chart review would have to be done if you did get a transfer in that had the first dose and not the second, right? Because I'm wondering just how can we flag this, because it's unusual for a vaccine to require 2 doses fairly close together, right? So this is new. So how are we going to communicate if it's not within the same organization? I guess that's a question.
You need to work with your IS department and with your vendor, because how that information comes into your system will be critical. If you are doing an electronic exchange of information, what we call interoperability, then that data should come in as discrete fields with specific coding behind it. It's called a CVX code. And so Pfizer vaccine has the same CVX code everywhere. Moderna vaccine has the same CVX code everywhere. And so when that coded information comes in, I can then run logic against what's in that particular data element and know if that's one that I need to be concerned about. So definitely you're going to need to leverage the IT in your organization, plus they're going to need help from the vendor.
And Louisa, these are HL7 transactions?
Well, yes and no. So the transactions that we send to Rhode Island Department of Health are HL7 transactions. The healthcare exchange interoperability stuff, that is what they call a continuity of care document, which is its own specification, but it is a standardized specification, includes discrete data elements, and can be used in your organization. You might have to do something like reconcile allergies, reconcile problems, look at your, reconcile your immunizations. That's standard workflow in all organizations these days.
A quick question. Are patients going to be able to input this information on their own, or are you going to depend on the registries to get good information? So basically on the continuity of care form, or on this bidirectional interface from.
Yeah, that's a really great question. And today, Lifespan has not enabled that functionality, although it is functionality that we could allow patient-entered information through their portals. But today we're not allowing that for vaccines.
I'm sure that's a whole different
It's a whole thing on its own, yes.
Yes, absolutely. Any other questions? Well, if there are no more questions, then I'm going to thank you both for a wonderful evening, for a great presentation. And I'd like to remind our audience, and there'll be messages going out soon. Tonight's presentation was not a CE offering, but we will start our CE programs in March. And our next program is March 16th, and it will be on open notes in the 21st Century Cures Act. And we're going to have Jan Walker come from the BI Deaconess Medical Center and share some of her experiences from lessons learned. And I'm sure we will have a lot of our members who have already gone to this, to open notes that we'll be sharing. I'm sure it'll be quite a dynamic evening. So I hope
that's
you
going
will
to be a
join
fun
us.
one. That is going to be a fun one, yeah.
Yes, please feel free to come back. So thank you, everybody, and look forward to seeing you in a month. And keep up the good work, Lori and Louisa, and Sue.
Thank you.
See you later.